Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, September 30th, and this is our COVID briefing. We've had 872 cumulative positive cases in Missoula County to date. That's up 216 new cases since this time last week, and 33 new cases since yesterday. We've had 575 recoveries and 3 deaths. 6 Missoula County residents and 8 out-of-county residents are currently hospitalized in Missoula County. We now have 294 active COVID-19 cases. We've currently identified over 1,240 close contacts, and those active cases and their close contacts remain in quarantine and isolation, and they're being monitored and supported as needed. The state of Montana is reporting 13,071 cumulative COVID cases, which is up 348 new cases from yesterday. There are now 3,635 active cases in Montana, with 170 active hospitalizations across the state. There have been 180 deaths related to COVID-19 statewide. The University of Montana has had 127 cumulative associated cases since the beginning of fall semester, with 11 new cases since yesterday. There are currently 78 active cases associated with the University of Montana, so that's only about a quarter of our total active cases at this time. Remember that you can find the most recent data updated daily on our website at missoula.co/cvirus. As indicated by our numbers, we're starting to see a rapid increase in COVID activity in Missoula County. Our active COVID case rate per 100,000 people is currently at 260, which is more than 2.5 times the 101 that we were reporting last week. The state of Montana as a whole is seeing 325 active cases per 100,000 people, which is up from 244 last week. Our reproductive value in Missoula County is now the highest that we've seen so far in this pandemic at nearly 1.7. Just a reminder that at this time last week, we were still holding below 1. We're continuing to see the largest source of exposure as close contacts to a confirmed case. The age group that's most affected at this time is the 20 to 29-year-old age range, with more than half of our active cases falling into that age category. There are a multitude of reasons that we're seeing this increase in this age range. Many of the people in this age range develop very mild symptoms that could easily be mistaken for other things. So it's really important that if you start to develop any symptoms, isolate yourself right away and make sure that you get tested. And you can call 258-INFO to schedule a free test through our clinic. We also need to keep in mind that this age group tends to work in many of our very public interaction frontline workforce, such as in restaurants, bars, grocery stores, coffee shops, and many other such places. This puts them at risk of developing the disease from the increased interactions with the public. Many people in this age range also live with roommates rather than alone, which also increases their chances of exposure. So if you are part of that 20 to 29-year-old age category, it is important to remember that while the severity of the disease may be minimal for you, you are still able to spread it to those who may be more vulnerable. In fact, the CDC released a report last week showing that often when we see a spike in cases in the younger age groups, we could expect to see an increase in the number of cases in people who are 60 years of age and older within the next 2 weeks. We'll be keeping a really close eye on that here in Missoula over the next week or so, but would encourage everyone to take precautions. Limit your social activities, practice safe physical distancing, and please adhere to the quarantine and isolation orders if you've been contacted by our staff here at the health department. We've received a lot of questions about what might trigger an increased restrictions as we're seeing this significant rise in cases. I just want to remind everyone that while there's not one magic number that would cause us to enforce additional restrictions, that actually a number of points that we consider. We primarily need to protect our healthcare infrastructure, so if our healthcare systems begin to become overwhelmed, we would need to impose restrictions. Another factor that we consider is our ability to do adequate testing and timely contact tracing. Right now, we have the ability to test anyone who's having symptoms and anyone who's been identified as a close contact to a confirmed case. We also look at our own ability to do timely contact tracing. We're stretched a little thin currently in this area, but we're actively adding additional staffing to increase our capacity. One thing that you can do to help us is to just answer your phone in case we're trying to reach you, and please call us back if you get a message from us. We spend a significant amount of time and resources attempting to reach people to notify that you are a close contact, so we could speed that up if you could answer the phone when we call or call us back right away. One of the other things that we consider when we're thinking about restrictions are where the cases are occurring. Are they occurring in clusters? Are there particular types of locations that we're seeing transmission? Are there other ways that we might be able to mitigate based on this information? So those are the factors in the data that we look at when deciding if we need to pull back in order to slow the transmission. I know we've gotten some requests for me to do more frequent briefings as we're seeing cases increase, and I just wanted to let you know that I hear you and I totally intend to increase my communication with you. This past week, we've just been really busy with the increase in cases, and I've had difficulty finding the time to do these briefings, but I am going to start doing them more frequently moving forward. Another topic that we've gotten a lot of questions about is masks. Specifically, if masks prevent transmission, then why are we seeing more cases of COVID right now? Remember that masks are only one tool in our toolbox for preventing the transmission of COVID-19. They should be used in addition to frequent hand washing and strict social distancing. Many of the cases that we're seeing have been identified because they're a contact to a confirmed positive case. They develop symptoms and then they test positive. This is not a case of stranger danger. We're spreading it to each other. Mostly we're seeing clusters of cases that are occurring in workplaces, among coworkers, among groups of friends and family outside of your immediate household. It's important to remember that while you're around those people that you're really close to, you should still practice prevention measures. Stay home and get tested right away if you develop any symptoms, wash your hands, practice strict social distancing, and wear your face covering. We're finding that we get lax in those prevention measures when with people that you're around all the time, and that is what's driving the spread of COVID in our community right now. Lastly, I just want to let you all know that you'll be seeing a change to our website soon. Hopefully by the end of the week, you'll still be able to go to missoula.co/cvirus, but there will be a link there that will take you to our new and improved website where the data and the guidance will be much easier to find. So that's it for my briefing for this week. As always, you can subscribe to us on YouTube under my name, Cindy Farr, that's CindyFarr. Click that little notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department Facebook page. You can call 258-INFO if you have questions about COVID-19, would like to know what resources might be available for you, or you would like to schedule a test through our drive-through testing location out on Flynn Lane. And you can, as I said, check out our website, missoula.co/cvirus. So until next time, everybody, stay healthy.